No other flap in reconstructive surgery is associated with as rich history as the paramedian forehead flap. Forehead flaps are first described in Susruta Samhita in Sanskrit surgical manuscript dating about 700 BC. The paramedian forehead flap can be rotated up to 180 degree to reconstruct nasal or paranasal defect. It can also be used to reconstruct horizontally oriented defects of the contralateral brow. The point of rotation is the median brow, which represents a transition of supratrochlear artery into more superficial tissues. Below this level, the artery lies superficial to corrugator supercilii and deep to the orbicularis oculi. A Doppler probe can be helpful to locating the supratrochlear artery and the position of the pedicle, but it is not essential. Flap is elevated in superior to inferior, distal to proximal direction in the loose areolar plane just of the pericranium. If necessary, significant thinning of the flap, including frontalis resection, can be achieved to a point roughly about 1 centimeter of the brow because of the very superficial position of the supratrochlear artery. The paramedian forehead flap is generally designed as the interpolated flap with vascular pedicle divided after 3 weeks once an autonomous blood supply is established to the recipient side. It can be tunneled under the glabellar skin as island flap for the single stage reconstruction. We can do in single stage reconstruction in some cases by the tunneling of this flap or deepithelialization of the pedicle part which is going beneath the skin. The paramedian forehead flap is extremely reliable and has clearly stood the test of the time. It provides excellent color, thickness match, and minimal donor city morbidity. It remains the reconstructive modality of choice for external coverage of total and subtotal nasal defects. This with the pericranial flap can be used with the reconstruction of the anterior skull base and nasal lining defect with the forehead flap, and it provide vascularized tissue for the anterior skull base and nasal lining defect. Even how much the defect would be, it can clearly reconstruct the anterior skull base or nasal lining defect